last portion of our module on health inequity under COVID-19 is going to focus on syndemics. And that might be a word that you're familiar with. It might be a word that you're not familiar with. But I invite you to sit down and engage and hopefully learn a little something about how COVID is impacting another public health emergency that we've been in the middle of for the last 4 years. And so the question that I'm really wanting to ask for this part of the module is, how do the COVID-19 pandemic and the overdose crisis intersect? And you may have varying levels of familiarity with what's going on with the conjoined opioid and overdose emergencies in British Columbia, and I'll give a bit of background. You're not required to know a lot about that for this portion, but that's what we're really going to be looking at here. And so in terms of background related to the overdose crisis, we know that between January 2016 and September 2019, which is the last time that national numbers were released, that more than 14,700 Canadians have died of a fatal overdose in that period. And we know that number is a lot higher now, but the data haven't been released nationally yet. In British Columbia, since January of 2015, we've had 5,919 British Columbians die of a fatal overdose. We are known nationally as the epicenter of the overdose crisis, and that's for a number of reasons that are sort of outside the scope of the current lecture, but that is a lot of people. A public health emergency was declared in BC in April 2016, actually, I believe, not 2015. There's a bit of a typo there. And that public health emergency is ongoing. And there are many interrelated causes of the opioid epidemic. A key factor that I want to emphasize here is that there's a toxic drug supply that's been adulterated with fentanyl. So people used to go onto the street and buy heroin and understand that it was heroin. But now if you go onto the street and you try and find heroin, it doesn't really exist anymore. People call it down. And there's fentanyl in the drug supply, and it is a very high potency opioid. And so in 2019, BC began to see a small decline in the number of overdose fatalities. And I think it's important to distinguish between that decline that we saw in the number of overdose fatalities and the number of overdose emergency calls, because the number of overdose emergency calls has continued to increase. And so the decline that we're seeing, which is the result of being better able to keep people alive when they do overdose, has largely been attributed to intensive efforts to prevent overdose death. And those efforts involve things like supervised drug consumption facilities like Insight or an overdose prevention site, widespread naloxone distribution and training. So naloxone is an injection, an intramuscular injection that can be administered to reverse the effects of an opioid overdose, as well as the expansion of the treatment system and different treatment options. And so, in 2019, our levels of overdose went down pretty considerably. However, one of the things that has emerged in the midst of the COVID-19 pandemic is that overdoses are surging. Since the beginning of the pandemic, there's been an enormous surge beginning in March. In March, there were 112 fatalities in March. That's versus 75 in February, so a very significant increase. And in British Columbia, there were 117 fatalities in April in 2020. And in 2019, there were only 84. In May, BC recorded 170 overdose deaths, and this is the highest number that has ever been recorded. And what this really points to is how fragile the progress that had been made in starting to get overdose deaths to decline, how really fragile that progress has been. To give you a sense of the magnitude of the COVID-19 pandemic, this graph shows the difference in the number of COVID-19 deaths versus the number of overdose deaths in BC. COVID-19 deaths are in blue, overdose deaths are in red. So what you can see is that every month the number of overdose deaths is considerably higher than the number of COVID-19 deaths. But I'd really like to point out that the response to COVID-19 has been significantly disproportionate to the number of deaths relative to the number of overdose deaths. So that's something that's really important to point out, is that we are panicked about COVID-19 and we are doing what we can to stem the spread. Meanwhile, there is another public health emergency that is happening that's having a very significant impact on the number of people dying in the province. And so, this is what we call a syndemic. And I just want to offer a bit of definitional background here. So, an epidemic is a widespread occurrence of an infectious disease. And a syndemic is a co-occurrence of multiple epidemics that interact and worsen the effect of one another. And a syndemic is defined by three main characteristics. The first is the clustering of two or more diseases or health conditions within a population. And so it's not necessarily an infectious disease restricted classification. Secondly, that contextual and social factors that create and reinforce the conditions in which the two or more diseases cluster. So the idea here is that those clustering or the clustering of disease is exacerbated by contextual and social factors that are operating to reinforce both of them. And third, that the interaction of disease clusters results in worsened disease burden among the affected population, right? So the idea is that you can have an interaction between the conditions around one disease and the conditions around another that magnify or amplify the disease burden. And so the idea here is that you've got health conditions who either for which either the condition itself or the response to the condition mutually reinforces the conditions that produce adverse health outcomes. And so when the pandemic broke out way back in March, there was significant concern, back in March in British Columbia, even though we know that COVID-19 was, and SARS-CoV-2 was circulating in the population well before that, there were significant fears that the pandemic would have an adverse impact on the opioid crisis. The idea here was that people who use drugs in inner city neighborhoods would be disproportionately affected for a lot of the reasons that we've discussed related to the concentration of disadvantaged populations spatially and pre-existing health conditions within people who use drugs. There were also fears that the pandemic would exacerbate the opioid and overdose crisis in ways that are related to a lot of our response to the crisis. And so you can cite all kinds of potential reasons why people were very concerned. And they are related to things that we've talked about, like lower socioeconomic status. But we also know, for example, that people who use drugs experience barriers accessing healthcare, and that the ways in which healthcare reorganized in response to COVID was going to exacerbate those barriers. That people might have pre-existing conditions. They might also experience challenges related to physical distancing. So having the resources to be able to physically distance, having access to appropriate sanitation, homelessness, things like this. And so far in Vancouver, we haven't seen an anticipated increase in SARS-CoV-2 infection in inner city populations. So there have been infections, but the surge that was anticipated has not come to pass. But what we have seen is that in British Columbia, in Canada, and across North America, we've seen a significant increase in overdose fatalities. And so, for example, the American Medical Association very recently just reported an increase in opioid-related overdose and some guidance around prescribing to how to potentially reduce that surge. And in Canada, we know that the pandemic is worsening the overdose epidemic. We've got the data around that. And there are a whole host of explanations circulating, and I would really like to focus on 3 of those potential explanations. The first is that the reason why we've seen the surge in overdose deaths under COVID-19 is because of the impact of the response to COVID-19 on the drug trade. And so, for example, closed borders and interrupted supply chains have changed drug markets. This article in the Washington Post really focuses on how the price of coca has dropped, people have stopped growing it, and that has increased prices in markets. And so that is something that we're seeing, and so people are potentially returning to different drugs or to different formulations of drugs, or the concentration of those drugs is different, or the purity of them is different. And so drug supplies have really become unpredictable and unreliable. And so someone who was using a particular amount before might use the same amount now, and it might be more potent or less potent, or we don't know what the purity of the drug supply is, and that has changed. And because we don't have a regulated drug supply, it isn't something that's regulated, people who use are using in a very uncertain environment. What we've seen in British Columbia in the last report from the coroner's office were reports of extreme concentrations of fentanyl and high-potency opioids in postmortem toxicology reports. And so what we're seeing in the coroner's data is that it looks like the drug supply under COVID has become more potent. The second explanation that I want to focus on is around service closures. And one of the things that we've all experienced is things have shut down. We don't go shopping anymore. No one could go to restaurants. And these closures have also affected services that people rely on. And so many frontline services have been forced to reduce or suspend their services. And this impacts things like food security, social and health service access, access to harm reduction facilities, so overdose prevention sites, and supervised consumption facilities have had to reduce their capacity, for example. It's been harder to access clean needles, etc. These services also act as sources of stability. They're a point of institutional contact for people, and that increases levels of stress, and that could potentially change people's level of drug use, and it might change the kind of drug use that they're undertaking. And so that's really important to remember as well. The third potential hypothesis that I'd like to deal with is around public health measures. And it's really important to remember that people who are living in poverty and people who face challenges related to substance use, those individuals are going to encounter significant challenges in terms of physical distancing. And so, for example, they might not have access to the most recent information about what should be done on a given day. They might not have access to PPE. We all know that it was impossible, for example, to get hand sanitizer at the beginning of the epidemic. People might also not have access to hand washing facilities or appropriate sanitation. And the idea of staying at home is all fine and good, but for people who don't have a home, the idea of physical distancing is extremely challenging. In addition, people who follow physical distancing guidelines may be more likely to use drugs alone, and we know that using alone is one of the most significant risks that have been identified for overdose fatalities. And so what we see here is for physical distancing purposes, people in addition may avoid using the services that are available to them. So they may decide, okay, I could really use supervision for the drugs that I'm going to inject today, but they might say, oh, I don't want to get COVID, so I'm just going to use here, it'll be fine. And so the interventions that would normally be happening to keep people alive aren't happening in the same way. And so there have been a number of important responses to the syndemic. For example, what we have now are called risk mitigation guidelines, or what's also known as safe supply, whereby there are now physician prescribing guidelines that allow physicians to provide a legal supply of medical grade psychoactive drugs so that people know how potent the drugs they're taking are. There's been an increase in benefit payments, $300 in provincial income assistance payments, and the federal CERB benefit that have helped provided resources that support physical distancing. The province has had a rapid housing initiative, although there have been criticisms of that housing initiative in terms of focusing on people who are homeless in certain places at the ignoring of people who are in other places. There have been COVID-19 hotels to physically separate infected individuals. There are respite spaces for low-income neighborhoods to allow people spaces where they can find some relief out of doors. Significant coordinated service responses by organizations on the downtown east side. And there are pandemic-specific harm reduction guidelines that have been developed to really support people to use in safe ways. For example, people are often using drugs over Zoom together so that if one or the other has an overdose, the other person that they were talking to over Zoom could call 911 to have someone intervene. And so, in summary, one of the things that's really important to think about is the degree to which COVID-19 is affecting other ongoing health challenges. So we know that syndemics occur when multiple epidemics that interact and worsen the effect of one another co-occur in ways that affect the same population. That's what a syndemic is. We know that while a COVID-19 outbreak has not occurred among inner-city populations in British Columbia, the COVID pandemic has had significant impacts on drug-using populations, and this has resulted in a significant spike in non-fatal and fatal overdoses across the province, across the country, across North America. And while considerable measures are being undertaken to prevent further escalations in overdose deaths, one of the things that this case is really showing us is that societal level shocks to our various institutional systems, and I would classify COVID-19 as one such shock, don't affect all communities equally. And a health equity perspective really requires tailored responses to mitigate these impacts, to try and make sure that appropriate resources are being distributed really to the people that need them. I thank you very much for your attention. I hope you've learned some things, and I wish you all the best of luck for the remainder of your course.